It's UofL Today on 93.9 The Phil. Here's your host, Mark Hebert.
And welcome to UofL Today with Mark Hebert on 93.9 The Phil. We're going to get right to it because we've got an action-packed show today. Do needle exchanges really work to curb fatal drug overdoses in Louisville and other cities? We'll be talking about that. And 20 years ago, she was a young leader in the fight for Louisville's Fairness Ordinance. Today, Lisa Gunterman is the head of UofL's LGBT Center for Students at a school nationally recognized for its LGBTQ-friendly policies in campus. And we'll be talking to Lisa a little bit later on. But first, Kentucky's Hepatitis A outbreak was the deadliest in the country. Measles outbreaks have been caused by a lack of child vaccinations in other states, and the drug fentanyl is wreaking havoc and killing drug abusers here in Louisville. There are a bunch of public health dilemmas to talk about, and the person to talk about them is Dr. Sarah Moyer, who's the director of the Louisville Metro Public Health Department and a faculty member in the UofL School of Public Health and Information Sciences. Sarah, good to see you.
Good to see you, too. Thank you for having me here.
All right, so we've got a bunch of things we need to plow through here in about 8 minutes. Hepatitis A outbreak. There was a large series in the Courier Journal talking about questioning whether the state of Kentucky handled the hepatitis A outbreak. And I think there's been 45 deaths, something like that statewide. But I saw your response that said Louisville was a little bit different than what happened in the rest of the state. So why don't you talk about that?
Yeah, Louisville got hit by the hepatitis A outbreak first in the state of Kentucky, and over the course of the last year, we have had 651 cases, really kind of peaked last April and trended down since then, but we're able to get it under control in about half the time and 1/20th the amount of money that other cities like in California spent on it. And so really the CDC called our response the gold standard across the country, and we've been advising and giving input to everywhere else that's been hit by it as well too. The Courier Journal highlighted that Kentucky's still experiencing the outbreak. It's still starting to trend down now, but they had a little bit harder time getting it to trend down as quickly just because of the poor public health system, not really necessarily a lack of resources or a poor response. It just really highlighted the lack of investment that we've given public health across the state of Kentucky over the last 20 years.
So what did Louisville do differently than everybody else did?
A couple things. One, we have great relationships with our medical system. So the actual public health department only gave about 9,000 vaccinations, but we were able to mobilize the medical community, and so anyone could go to any pharmacy, their doctor, their emergency room to get vaccinated, and so used other resources appropriately. Two, we had a great syringe exchange program up and going already, and so we're able to reach our most vulnerable populations, which a lot of rural Kentucky didn't have up and going at the time. And so we were able to vaccinate all our participants. And then also a great connection with our corrections department, where so the two high-risk groups are people who use drugs and homeless. And unfortunately, those are some of the most common people in our correction system as well, too. And so we're able to vaccinate them because of the great relationship we have with our corrections department.
Talking with Dr. Sarah Moyer, who's the director of the Louisville Metro Public Health Department and a faculty member in UofL School of Public Health and Information Sciences. We're talking about some of the public health dilemmas facing the United States and the city of Louisville here in the past couple of months. So let's talk about measles. Washington State had a big outbreak of measles, predominantly because a number of parents didn't have their kids immunized for MMR, and they didn't get the vaccinations. Is that a potential problem in Louisville, Kentucky?
It always is. So measles is very, very highly contagious, and we've been able to not have an outbreak here in a lot of years because of pretty good vaccination rates, but you never know what's going to happen tomorrow, and so we are always looking out for it and training our healthcare providers to recognize measles because it's not something they've seen in a really long time, and are really hoping that it doesn't come here.
But the vaccination rates in Louisville and in Kentucky are much higher than they are in those pockets in Washington State and other states that have had that problem, right?
Yes. So we've our vaccination rates are much higher than other parts of the country, and just trying to get the message out that hope that stays because of that herd immunity that is provided when people get vaccinated. You're not just protecting yourself, but you're protecting everybody else around you.
And it's reared its head again, this question about does the measles vaccination cause or could it lead to autism in children? That's been a debunked study that they're relying on. But what would you tell parents about that? If they see something on Facebook or something like that that says, "Oh, be careful of the measles vaccine, the MMR vaccine."
There's never been any studies to prove that, and so just if you have any questions or concerns, just talk to your pediatrician, your family physician. That is the best person to go to for advice if you are even thinking about not vaccinating your kids.
Right, and they're required to be vaccinated unless you opt out for
school.
Yeah.
Yep. Yes.
Okay. All right, one last thing. Fentanyl. A lot of people don't even know what that is. They know what heroin is. They know what opioids are. But fentanyl has been just a scourge, apparently, in the Louisville area and across the United States. Tell us what fentanyl is and what's been the problem in our area.
So fentanyl's a synthetic opioid instead of heroin, which gets grown from a plant. You can make fentanyl in a lab, and so it's a lot cheaper. It's a lot more potent. It takes a lot less of it to get the same sort of effect that you get from heroin, and so it's grown in popularity across the U.S. and moving across the country. It's being seen mixed with any other type of drug. So we're seeing an increase in methamphetamine here in Louisville, but fentanyl is being found in that as well too, in cocaine, in heroin. It's in almost every drug that we've seen.
Some really difficult health problems, public health problems in the Louisville, Kentucky area and across the United States. We're now joined by Jelani Kerr, who's an assistant professor in the School of Public Health, and Dr. Sarah Moyer is still here. We're going to talk about how needle exchanges can curb fatal drug overdoses, or can it? And they've done a study on this, and so we're going to take a look at that. Jelani Kerr, welcome back to the show.
Hey, good to be here. How are you?
All right, well, let's talk a little bit about this study, this overview that you two did on needle exchanges. What can you tell me about it?
Okay, well, needle exchange. So we know that. So you remember a few years back there was this big cluster of new HIV cases in Indiana. So what do we do? And we know that it was about heroin use and sharing needles. So what can we do to reduce risk for bloodborne diseases like HIV, hepatitis C, in a situation like that? Well, one of the strategies that we can use is needle exchange. It's very simple. You go to the health department, or you go to a mobile syringe exchange site. You bring your old needles. They give you new ones. That way you're not sharing needles. You're not sharing blood. It reduces risk for HIV and hepatitis C, and it's pretty effective, and it saves money.
So
it's cheaper than treatment.
Is that essentially what you found in the Louisville study when you looked at it?
Yeah, the study really highlighted the struggles and how we went about setting it up. So like Jelani mentioned, huge HIV outbreak going on in Austin, Indiana, just 35 miles north of here, which really spurred our state legislator to pass and made it legal for us to operate a syringe exchange locally. Up until that point, it wasn't legal for us to run it, even though there have been syringe exchanges up and going around the country for 30 years. And we know all the great evidence for it. And so this let us start one, and we were the first in the state to open in just 10 weeks after that legislation passed. So proud of that, and proud of all the work that we did to get it up and going. And currently we've got 17,000 individual participants who come to our syringe exchange that we've seen over the last 3 years, and so it's even grown since.
Wait a minute, back up a little bit. So there's 17,000 people in the Louisville area that are doing the syringe exchange. So is that 17,000 people, or is that 17,000 individual instances of exchanges? That's a different number.
No, it's 17,000 unique participants, way more exchanges from that.
Okay. And Jelani Kerr, when you were talking about it a minute ago, you said it saves money. How does it save money?
Well, so an ounce of treatment is worth an ounce of prevention is worth a pound of cure. So if you prevent disease, then it actually ends up being a lot cheaper than actually having to treat it. So it's like anything. If you prevent your common cold, you save on doctors bills, and it's the same thing. It's just on a larger level. So if you can prevent some of these diseases, you save a good bit of money.
One syringe costs about 8 cents versus the cost of treatment over a lifetime is millions of dollars for a patient who get HIV, and so the return on the investment is huge.
Yes.
We're talking with Jelani Kerr and Dr. Sarah Moyer, both from the School of Public Health and Information Sciences at the University of Louisville, and we're talking about the needle exchange that you call it a syringe exchange. I call it a needle exchange. Is there any difference? It's the same thing, right?
Yeah, same thing, just different language. Yeah, I think when they first started, it was needle exchange, and now terminology is more syringe access is probably the more proper way to call it, but it's all the same thing.
Okay.
Yeah.
And so when you're looking at these folks that are coming in, are all of them, I guess, hardcore drug users that are coming in? And what happens when they do come in to try and get them to wean off the drugs? Is there any follow-up, or is it just a no questions asked kind of thing? You hand them the needle and say, please don't come back?
No, we want people to come back.
Well, please don't come back with an overdose. I'm sorry. I should have extended that sentence a little bit more.
Yeah. No, it's our staff are trained in harm reduction, so it's really about meeting people where they are. So no matter where they are, I mean, it's a huge range of people who've been injecting drugs for a lot of years versus just starting, versus employed versus not employed, homeless. And so it's a very wide range of people that are coming. And they meet them where they are, teach them how to inject safely to prevent infections like endocarditis and abscesses, get screened for HIV, hepatitis C. We gave vaccinations for hepatitis A there during the hepatitis A outbreak. We still are giving out naloxone, and just last week started giving out fentanyl test strips. So anything we could do to reduce harm and then build that relationship to connect people to treatment when they're ready.
Jelani, from your view, do you think that the messaging around these exchanges works? In other words, is the public buying in, and are the people who are using them, obviously they're buying in if we got 17,000 of them, but are both sets of people buying in, both the taxpayers and the people who are using them?
Well, like you said, clearly the clientele sees the benefit of it.
Right.
I think we're trying to get the message out that there are a few misconceptions around syringe access, syringe exchange. One, it doesn't increase drug use. This has been thoroughly studied, thoroughly researched. Having a syringe exchange doesn't increase drug use, but it may be the only opportunity that people may have to get in contact with somebody who can link them to treatment.
Like Sarah was talking about.
Right. When they're ready, drug treatment, HIV testing, the variety of services that are there. So I'm hoping that the messaging goes out, and that it's recognized as a public health problem, and this is an effective public health solution.
Are there other misperceptions about this program? Obviously, the big one is that you're just handing drug users these things, so they're going to keep using drugs, and more people are going to come in and start using drugs. But that's the biggest one. Are there any other misperceptions about this program that you need to dispel in your mind with legislators or others?
That's the biggest one, and then I think there's a lot of concern about putting more needles out on the street as well too. But really, study after study has shown that providing access and teaching them how to dispose of them properly actually decreases the number of syringe exchange. I mean, we've got great data to show that it decreases the number of needle sticks that our police officers experience and our first responders. It decreases syringes on playgrounds and parks and other places because we're handing out sharp boxes and teaching them how to dispose of them properly. Nobody worries about the diabetic leaving a syringe in a park, but for some reason, with a different brain disease, they're really worried about it. And so just those are probably the two biggest ones. But yeah, I mean, people who are access to syringe exchange 5 times more likely to go into treatment than people who don't, and then definitely reduces needle sticks and syringes that are on the street.
So the bottom line, from a public health perspective, and what happened in Louisville, Kentucky, in the Louisville area, you would tell other locations and other states that are considering the needle exchange, you would tell them what?
So, So
it works,
article,
right?
It works. We published this article in the American Journal of Public Health to give guidance to to the scientific community, to other people who are interested in syringe exchange, to help give guidance to helping to establish one, working with stakeholders, working to get community buy-in, having people from the medical community, the treatment community, the harm reduction community all in a room working it out. Right. And we think we are, if I can speak for you.
Yeah,
okay.
Go for it.
More work needs to be done, but think that it's been pretty effective so far.
Okay. so far.
Very effective. And we were the first in the state of Kentucky. I think there's over 43 now across all the counties. So Kentucky went from being one of the few states with 0 syringe exchanges to being the one with the most number. And part of that's because I think of the great work that we did, but also because of the huge need in Kentucky for this type of program.
All right, Dr. Sarah Moyer, Jelani Kerr, I got to wrap this segment up, but appreciate you being on the show. 20 years ago, she was just a kid on the front lines of the push for the Fairness Ordinance in Louisville, which extended employment and other protections to lesbian, gay, bisexual, and transgender people in Louisville, Kentucky. And today, she's the new director, well, relatively new director of the LGBT Ctr on the University of Louisville campus, and her name is Lisa Gunterman. Lisa, good to see you, as always.
Hi, Mark. Good to be here. Thank you.
All right. 20 years ago. You were just a kid, weren't you?
I was 12.
I saw some pictures. I was 12.
I was in my early 20s.
Yeah.
When we, I got involved in the movement in my late teens. I actually got involved in the social justice civil rights movement, and I was literally going to something every night, but nothing was LGBTQ related. And I always say we stand on the shoulders of giants, and we benefited from having a lot of elder civil rights leaders mentor us. And one night at a meeting, an elder pulled me aside and said, it's okay to stand up for yourself too. And I about burst into tears because I had never had an older person in my life say that to me about my LGBT identity.
Yeah, and so that was the first time you really said, you know what, maybe I can make this disobedience and fight for civil rights thing, make it work?
Make it all inclusive, and we still, the unique thing about Louisville is that didn't mean that I stopped doing the other work. We did it all together, and I feel like Louisville was unique in that way. I go to other communities and everything's very siloed, but in Louisville, if Maddie Jones or Reverend Lewis Coleman called and said, hey, we need you all here, we went. A lot of times we didn't even ask questions.
Yeah.
But it was a great education.
What are we protesting again?
Right.
Lewis, huh?
That's right. It was a really great education, too, because I learned so much from them that I was never taught in school. And I joked with my mom. I said, I've prayed more on sidewalks probably than in churches because part of it is you gather up and you pray first and then you go to your action whenever you were with the Reverend. So,
all right. So you were quite the activist in your 20s. How did you wind up at the University of Louisville?
What's interesting is the first time the job was posted,
What was the job?
I think it was
Assistant
a program
director
coordinator senior, I believe.
Okay.
And when the job came up, I thought, oh my gosh, that sounds like something I would love to do because in addition to fairness work, I'd worked for 10 years as a mentor for the Louisville Youth Group as a volunteer. And I've joked that I've been an advocate for LGBT young people since I was a young person. So when the job came open, I thought, oh my gosh, this sounds like a dream job, and I would love to work at the University of Louisville. And at the time, I was working for the city, and there was literally no extra time in my schedule to even update my resume because we were working on an event and a youth program and all these different things. And I thought, okay, it's just not meant to be. And then a few months later, the job reposted. They had a failed search, and I was walking to a meeting, and my phone is literally like blowing up with people saying, have you seen this? You need to apply. And I didn't know if they would consider me or not, so I, put my information together, tried my best, and now here we are.
Okay, so you go to work for UofL back in what year? What year did you come to UofL?
2011.
Okay, so 2011, so 8 years ago. Brian Buford, who founded
Yes.
the LGBT Ctr way back when, 10 years ago?
2009.
Okay, 10 years ago. So he gets bumped up, he gets a promotion, and so then you were the assistant director, essentially,
I was
of
the program coordinator and then assistant director
of
yes.
the LGBT Ctr. So they bump you up.
That's right.
So here you are.
That's right. And the interesting thing about Brian and I is when I worked for the Fairness Campaign, he was already at U of L, and I joke that he was like the gay on campus. He was who people knew. Like if you wanted somebody to talk to your class, ask Brian. So every now and then he'd call me at Fairness and say, hey, what are you doing tomorrow? And I'm like, speaking with you. And back then, if you had told me then that one day we would be working together on campus and that there would be a center, I think I would have just cracked up laughing because it was a very different climate back then.
Talking with Lisa Gunterman, who's the director of the LGBT Ctr at the University of Louisville. What is the LGBT Ctr? I guess we ought to tell folks what that is.
All right. Our center is a part of the diversity unit, so we're housed under Dr. Maureen Taylor Archer's purview, and we're with the Cultural Center, the LGBT Center, Ali Institute, Women's Center, Diversity and Inclusive Excellence, and the International Centers. And together we tried to uphold the vision of U of L to make it a welcoming place where all students feel like they belong.
But it's on the day-to-day level, it's a place basically where students can show up and you don't even have to be LGBT, right?
Right, absolutely. We're open to everybody. And when people ask, who do you serve, the answer is the entire campus. So we have programs for students, faculty, and staff. We have a lounge where students can come and hang out, have lunch, watch YouTube videos, play games, whatever it is they want to do. And that office runs, I think it's about 2,000 hours a year. So we give a lot of referrals. So if students come in and have needs around academic needs or more intense struggles that they're having, we make sure we connect them to services. The other thing we do is we do a lot of educational programs, workshops, and events. I think last year with our programs, we served over, 18,000 participants because we had about 8,000 come to our events. We had about 11,000 come to our trainings and workshops.
And as I recall, Louisville, the University of Louisville, was the first public university in the South to have an LGBT center. Am I correct about that?
We're the first in the state.
I knew that.
And then we're the first in the South to have a 5-star rating for LGBTQ inclusiveness. Now we're happy that we're not alone in that. Our friends 80 miles down the road at the Blue School also have a 5-star rating, and we're really happy for them.
Yeah, at the Blue School.
But not in basketball.
Well,
we draw the line.
Yeah, we draw the line at that. So the bottom line is that the University of Louisville, I think you would argue that University of Louisville really has garnered a reputation as being very LGBT friendly, and we've gotten a number of accolades from different websites and those kinds of things, right?
Absolutely. And I think the other thing that makes U of L unique is I'm the director of the Belknap campus, but we actually have a center on our Health Sciences Center campus. And we were the first in the country to infuse LGBTQ competencies into medical school curriculum. So when our staff travel, they get questions from other people like, how are you doing this in Louisville and what's going on in Kentucky? People call us. We went from doing a workshop for 1 hour and 15 minutes 7 years ago to infusing 50 hours of competency training into medical school curriculum.
Mm-hmm. We're listening to UofL Today with Mark Hebert on 93.9 The Ville. We're talking with Lisa Gunterman, who's the director of the LGBT Center at the University of Louisville, talking more about what's on the Health Sciences campus and the training that's going on down there for students, faculty, and staff, everybody. So what's the idea behind having that training for how folks can deal with LGBT patients and individuals?
Mm-hmm.
Why do they need that?
When I have told people that I'm doing a workshop at the Health Sciences Center campus, I've had people say, tell my story. I want people to know. Virtually all LGBTQ people I know have had a negative experience with a healthcare provider. And if you want to truly serve your patients and deliver the best care possible, you're going to need to know a little bit more about their history and information. And to accomplish that, you're going to need to know how to ask important questions that will help you do your job as a healthcare provider. Just last week, we offered a training for first-year medical students and community members where they learned how to do an intake, how to really get patient information in a way that's inclusive and welcoming, because as a provider, you need to know things to be able to provide that care.
Right, and providers don't want to be offending. They don't want to,
Right.
They don't necessarily have to be overly PC, but on the other hand, you
Right.
don't want to offend somebody that walks in that may be gay or lesbian or transsexual into your office seeking care, right?
Right, and if you ask a question in a certain way, that's kind of a clue, marginalized people in general, I think, look for clues of, am I safe here? And that's the same for LGBTQ people. So if you ask a question that's very specific and doesn't include that person, that's a sign to them that they're not safe there. And they may not divulge important health information that you need to know as their physician.
And that goes back to where you said that U of L has become a real leader nationally in that training for their
Absolutely.
faculty, staff, and students on how to deal with it. All right, I want to get back on the Belknap campus for just a second and talk about, I think I've heard Brian talk several times about students from rural areas and small towns that come to the University of Louisville specifically because we do have a welcoming environment. So if you've got a particular case without using the student's name, have you got some cases that you have seen in your time at U of L where students have walked in and just had a real struggle in their hometowns but had managed to find a safe place at the University of Louisville?
Absolutely. We have an event called Cardinal Outlook Day, which is a campus preview day for LGBTQ high school students. And we had a family drive all the way from Alabama with their teenager to look at the University of Louisville. And as we shared a meal together, this family shared how, when their student went to their dance, for example, they took a date and no one would sit at a table with them even. So they talked about all their struggles in high school, how they didn't feel welcome. And when this young person got here, he just lit up and he just couldn't believe it. It was like he was seeing, Oz for the first time in color. And it was so wonderful to be able to say, you're going to be okay. And to be able to tell his parents, your student's going to be okay here and they're going to be part of this community. I think one of the most powerful things that has happened too is many of these young people, we know from data that 93 to 98% of young people in Kentucky have experienced discrimination in their high school. So when they come here, it's often the first time they've ever felt welcome or included. And last year, Dr. Ben DePuty came to our Welcome Week event, to visit with our first-year students, and just gave this wonderful welcome and said that, I honor your journey and where you've been. I know you may not have had all the support you need, but you're at U of L now, and you belong here, and that's what family's all about. And then she proceeded to give them her cell phone number, as many of you have seen her do.
We all know that.
But what struck me is, for these young people, that's their example now of what a leader says and does. And for our return students, I had some return students working with me that day. They literally had tears in their eyes because they had never heard a college president deliver an address like that. It was just a very powerful thing.
Yes. So good, there's that good feeling on campus. But do you ever get the question from somebody, perhaps that somebody, I'm guessing is probably a little bit older and didn't grow up in the generation of that my kids grew up in, where being gay it's no big deal. But do you ever get the question, why does U of L need an LGBT center? Do you get that?
Not directly to my face, but I know there are people. There are definitely people out there who wonder, and why do you get that? And at the end of the day, whether people are comfortable with LGBTQ people or not, this is really about our mission of helping students cross that stage at graduation. And I think regardless of differences, we can all get behind empowering young people to reach their dreams and get that degree.
Get an education and get the degree, no matter how you get there, and provide the support services to get them there. What do you see in the country right now? I mean, as a gay person yourself, what do you see in the country right now, and is it as divisive and hateful as some people say it is, or is it just, we're going through a phase?
It's very interesting because I was just talking to some friends recently that I personally, I'm outed just by showing up. And in the last 3 months, I've had some encounters in public that actually scared me and hasn't happened since about 20 years ago. So I think people feel emboldened to act on their prejudices. And one of the incidents, I had my son with me, and he's Latino, so that person was angry at both of us. And that's
one for brown skin, one for being
gay.
And
that's a really hard, thing to explain to your kid about why this just happened, and you need to be aware of your environment and that kind of thing. But then there's also people, so you have, people who are really upset and angry, but then you have people like community members, Greg Burke and Michael DeLeon, who decided to invest in the University of Louisville and start a scholarship for students that they've never even met before, who are Catholic identified and LGBT, and we think it's the first scholarship of its kind in the nation.
One more thing before you get out of here, you've got an event coming up.
We do, right? Yes. We have a fundraiser called Pink. It's a student-produced drag show fundraiser. It's going to take place at Play Louisville this year, so folks can go online if they want to get a table or a booth there. Tickets are at the door. It's $15 for admission, and if you're a student, it's only $5. We do ask students to bring their IDs, and it's a student of any school.
Very good. All right, Lisa Gunterman, always great talking to you. Thanks for listening to UofL Today with Mark Hebert, and go Cards.